Imagine a nurse recognizes a serious problem. Perhaps staffing no longer matches patient acuity. A new technology is creating risk. A community cannot access the care it needs. Or an education policy threatens the future workforce. The nurse sees the problem clearly, but seeing the problem and changing the decision are two very different things. Nurses already have a voice. Students, clinicians, educators, advanced practice nurses, and leaders recognize risk and unmet needs across care, education, workforce, public health, and policy. The problem is not that nurses have nothing to say. The problem is that nursing knowledge does not always reach the right people at the right time in a form that produces action. And that creates an advocacy gap. A concern may remain within a single unit, classroom, community program, or professional organization. It may be discussed repeatedly, but never documented. Or it may reach decision makers only after the policy, budget, technology, or workflow has already been finalized. By then, nurses are not being asked to shape the decision. They are being asked to manage its consequences. So the question is not simply, do nurses have a voice? The better question is, do nurses have a reliable way to turn what they know into influence? That is why nursing needs a shared advocacy structure, one that helps nurses identify issues, organize evidence, reach the right decision makers, and act with professional integrity. That structure is the voice framework. The five voice principles emerge from recurring concepts synthesized across 74 publications spanning levels 1 through 5 of evidence and integrated into the 10-article Mastering Nursing Advocacy curriculum developed and authored for this series. Across research studies, professional standards, policy frameworks, economic analysis, and practice models, five essential advocacy capabilities appeared again and again. Across the evidence, five recurring dimensions of effective nursing advocacy emerged. This became the five voice principles: visibility, outcomes, influence, clinical judgment, and ethical courage. Each principle addresses a different part of effective advocacy. Together, they provide a practical framework for moving from recognizing a problem to changing what happens next. When nurses encounter an issue, the voice framework helps them ask five questions. Is nursing visible in the decision? What outcomes are affected? How can this concern become a coordinated influence? What does clinical judgment reveal about the real system problem? And what must nurses say or do to act with ethical courage? These questions turn advocacy from a reaction into a disciplined process. Those five questions provide nurses with a shared approach to advocacy. And that shared process matters because nursing lacks neither numbers, knowledge, nor trusted professionals. What nursing often lacks is coordination across its many roles, specialties, organizations, schools, employers, and leadership structures. That diversity is a strength. But when messages, resources, and actions remain disconnected, millions of nursing voices can still fail to produce collective influence. That is why the voice framework must be practical across the entire nursing continuum. A student nurse can use it to understand how policy shapes practice. A clinical nurse can use it to raise a safety concern. An advanced practice nurse can use it to address access, scope, and population needs. An educator or researcher can use it to strengthen evidence and professional preparation. A nurse leader can use it to improve governance and accountability. And a nurse executive can bring nursing judgment into strategy, finance, workforce, technology, and policy. The nurse's role and authority may change. The responsibility to advocate does not. The voice framework gives nurses a shared language for turning professional knowledge into professional influence. Visibility brings nursing into the decision. Outcomes show what is affected and what must improve. Influence organizes people, evidence, and resources for action. Clinical judgment identifies the real system problem, and ethical courage ensures nurses act with integrity when silence could allow harm to continue. The future of nursing advocacy will not be shaped by nurses who merely have a voice. It will be shaped by nurses who know how to use the voice framework to move from concern to action.